welcome to Focus on Finance. I'm your host, Melanie Parker. Focus on Finance is brought to you by the Consumer Education Division of the Wright Legacy Group. Speaking of the Wright Legacy Group, today we have Austin Wright, himself from the Wright Legacy Group. Yep. Welcome, Austin.
Well, thank you.
Know you're a busy man. Appreciate having you in.
Absolutely.
You are the in-house specialist on Medicare at the Wright Legacy Group.
That is correct, yeah.
Okay,
yeah.
and we are right now in Medicare enrollment.
Yes, yeah, this is October, and
right.
so open enrollment starts October 15th.
Gotcha.
And so, yeah, we're right in the heart of the season here.
Right. So folks who is eligible for Medicare? When should you start looking at that?
Yeah, so Medicare is a government-funded program to help cover health insurance in the later stage in life.
Right.
And so you actually qualify for Medicare once you turn 65.
Okay.
And so
is that the only criteria? It's not based on income or anything, just age?
Sure, yeah. Well, the ability to enroll is based upon your age.
Gotcha.
How much you pay for it, that kind of stuff can be based upon how much you've worked or what you make, or how much income you have, that kind of stuff. And so, but we can cover some of that here a little more in depth as well. But so if you're getting ready to turn 65, you can enroll actually in Medicare the 3 months prior to turning 65, or up to 3 months after you turn 65. Okay. You can enroll without any kind of penalty, anything like that. And but that is just signing up for Medicare. The open enrollment period, which runs from October 15th through December 7th, is actually a time every year that you have the ability to make some different changes to how you're enrolled in Medicare.
Gotcha.
And so Medicare can be a little complicated. I always call it the alphabet soup of Medicare.
That makes sense.
Because you have the Part A, B, C, D, all the different things, the supplement plans, the Advantage plans, all that. It can be a little complicated.
It can.
And so that's something we like to try to explain and help people understand kind of what's going on and what changes they can make during the open enrollment.
Where do folks start? If a seasoned person may not have a computer at home, let's say I'm turning 65 next month or along those lines, and where do I go? Sure, yeah,
there are a lot of resources. If you can get online or you have somebody that can help you get online, you can just go to Medicare.gov. They answer a ton of the questions on there.
Great.
But even at that, though, can be a little overwhelming because you're like, okay, well, I understand what each of these are now, but how did they all fit together?
Right.
And so the library has some resources. There's some things you can go to there.
Good
they
old
have
library.
some resources you can get that help you understand that. And then also there's different places in the community that will have educational events. We were actually hosting one later this month on the 16th at the library.
Right.
October 16th, we're going to be doing a Medicare workshop to help people understand how that can work and stuff as well. But then I'm also here today to help people see, kind of understand a little bit more about what Medicare is, how everything fits together, and what this period of open enrollment is.
Okay. Is it required? I've never thought about that until now. But let's say I'm turning 65 and I have, let's say my husband's retired military and we have TRICARE and those types of things, and I feel confident in my medical coverage. Am I required to apply for Medicare?
Sure. So if you have what's called credible coverage, meaning that you are still currently working yourself and you have health care from your employer, or you are on a spouse's plan, say they're still active military, you're still using their health care. You don't have to change to Medicare until that credible coverage ends.
Gotcha.
So once you retire or once your spouse retires and you move off of their primary insurance, at that point, it's what we would call a wise course of action to change to Medicare. It would behoove you to do so. In terms of required, you don't have to. You can choose not to.
Ever. You don't have
to.
Gotcha.
All that means is that you are now responsible for all of your medical and everything out of pocket.
Who wants that? All right.
And if you decide later on down the road that you do want to have Medicare, you are actually penalized for every year that you delay your benefits.
Okay.
And so most people, if you pay into Medicare for 40 quarters, Part A is covered and free.
Okay.
And Part A is where most of your major medical is going to happen. Part A covers hospitalization, inpatient care. I always like to say A is for admitted. So if you're admitted into the hospital, something like that, that's what Part A covers.
Gotcha.
And so that's where that's one of the pieces, right?
That's the one you want because that's the big one.
That's the one that's the one that's going to help cover most of your most of your major medical and things of that nature. And so you will want to probably enroll in that. You can also enroll in Part B at that time. Part B is your outpatient care. If you go to see like your family doctor, or you have an outpatient procedure or just routine medical checks to make sure that you stay healthy, that comes from the Part B side of Medicare. And so there's two parts to Medicare. Let me just kind of explain kind of what those are real quick. Right. So you have Part A, like I said, is hospitalization, inpatient care, those types of things. For that, with Medicare, you actually do have a deductible like regular health insurance. And this year, 2018, that deductible is $1,340. And now that is per benefit period. So a benefit period is the day you're checked into the hospital, or where you actually are released from the hospital. If you are readmitted for the same purpose, or like a follow-up for the same reason you were admitted within 60 days, that's considered the same benefit period.
Gotcha.
If on day 61 you go back into the hospital, you actually have a new benefit period. So you have another $1,340 deductible. Most people think that you only have a $1,340 deductible for the calendar year, but that's actually incorrect. It's for a benefit period.
Gotcha. And for like a 60-day diagnosis.
Sure, yeah. Okay. So if you're in the hospital, you could be in the hospital for a week. From the end of that week for the next 60 days, if you're readmitted for the same thing, it's considered the same benefit period. But if you go beyond the 60 days, then it's considered a new benefit period, and so you would have to pay that $1,340 deductible again.
So if I am out in a week and then come back in for something totally different, a whole new diagnosis, that's considered a totally different period.
It can be sometimes.
Okay. There's a little gray there.
There's a little within the 60 days. Usually if it's in the 60 days, they kind of make
little loosey-goosey.
They should generally treat it as the same benefit period. But if you go day 61, they can't have that. It's not as flexible. And then things like that. You have to start a new benefit period. And so that's for hospitalization. Part B is for outpatient, like I said. If you go to your doctor, anything like that. It actually has its own separate deductible. It's a lot less. It's $183, and that's actually for the whole year. So if you pay the $183 deductible for that, then that'll cover.
Different animal.
And the co-insurance on both of those, once you meet your deductible, is 80-20. It's 80% they pay, 20% you pay. So it's not. Some people treat Medicare like it's a silver bullet for healthcare or for your health cost. It's not. You still have to plan on it. A plan for
deductibles.
The deductibles and the co-insurance. With Medicare, there's not. There's a different version of Medicare that you can take that has co-pays that it acts more like a traditional insurance. So the Part A and the Part B I just described, that typically falls under what's called the original Medicare or traditional Medicare, where you have your Part A, your Part B. You would typically get a drug plan, which is Part D. D for drug. That's pretty easy to understand. And those plans are really based upon which company you go with. They can be relatively inexpensive, from $20 a month up to $60, $70 a month, depending on what you need prescription-wise. And so you have your drug plan, and then there's what are called Medicare supplement plans, or you may have called them Medigap plans.
I've heard that.
They call them Medigap because they help fill in the gaps of what traditional Medicare doesn't cover.
Is that what the co-insurance is?
Sure, yeah. So a Medigap plan or a Medicare supplement plan, you would get that to help cover those deductibles, the $1,340 deductible, $183 deductible, and the 20% co-insurance. And the little random things like if Medicare doesn't pay for the first 3 pints of blood, if you need blood, the supplement will actually cover that. So all those little things that Medicare doesn't cover, the Medigap insurance or the Medicare supplement insurance can do that.
Do a lot of people carry the
most people will. There a lot of them.
Buffer.
A lot of people would prefer just knowing that, okay, if I pay my Part B premium and I pay my Medicare supplement premium, I am covered.
And
so
there's no surprises.
There's no surprises. You know what your expenses are. That makes it easier to budget. Even if it might be a little, you could find a little bit of a cheaper way to do it by kind of piecemealing it or together or doing some other things. A lot of people just like that peace of mind of knowing that, okay, health insurance wise, I'm covered. Now, one thing I do want to make sure that people know is that Medicare actually does not, they just cover hospitalization and preventative care. So if you were to need, say, rehabilitation or a skilled nurse care facility, Medicare doesn't, they pay for up to 60 days in a rehab facility. so many dollars a day, but after that they won't, and they do not cover skilled care, so like a nursing home or assisted living facility.
Right. So that's where long-term care insurance would come into play.
Yeah, that's where you would have to look at a different way to cover those costs is through a different type of policy.
Wow.
Yeah,
okay.
And everything
so
like
people
that,
actually have a little bit of control when they go in. I just thought Medicare, this is what you get.
Yeah.
But you go in and you have some options and some choices, and which is good.
Yes.
But can be complicated too.
It can. It can, especially right now. We're in a season where, if you're of age and people, you're probably getting inundated either in your email or in your mailbox with all these different plans saying, hey, you need to buy this. This is how it would work best for you. All these other things. Yeah. And a lot of those come from what are called Medicare Advantage plans. So we talked about the original track, the traditional Medicare track. There's actually a second track that you can go, which is called Medicare Part C.
Okay.
I like to call it C for corporate. So you think it's like a private company.
Right.
And so how that works is Medicare Advantage plans work more like your traditional insurance policies that you've had up until now. Okay. In that they can have vision, they might have dental, they can have different gym benefits, things like that attached to the plan. So it's a little more comprehensive in what it could maybe cover, but most of the time they'll have a copay. They could even have a little bit of coinsurance, things of that nature still attached to it. So they're more flexible in like that you can include some of the things that the traditional Medicare won't. Right.
Would that be in lieu of A
that
and
isn't, yes, correct.
Going with
so,
C, okay.
So that would be you get a plan from a company like Anthem Blue Cross Blue Shield, Humana.
And that may be someone
that you have, you're familiar with that company.
Right.
You want to maintain that relationship with them. You can do that. Okay. It acts more like a traditional insurance policy, to where there can be some gaps, things of that nature that you have to help cover. And if you're comfortable with that and that's how you want to do it, that's perfectly fine. That's a great way to do it. It's just a matter of you just need to know that and understand what you have going into it. You know, a lot of people at that point like the traditional Medicare because they can add the supplement to it and just know that everything's covered as long as they make sure those premium payments. So, other people like a little more flexibility, things of that nature, and so they want to have they go about it in a different way. And those are subsidized. So instead of using their Part A and Part B, the insurance companies get subsidized by the government to help keep those costs for those plans low.
Wonderful.
So that's how they keep, you know, the Advantage plans can be a little cheaper is because they actually are funded on the back end. They're supported by what they would be paying out in your benefits for if you were to go the traditional Medicare route.
So the traditional Medicare route, the A and B, is vision and dental, are those options within those? Or is that where the co-insurance
those are something that would be something you'd have to get on a separate policy for.
Gotcha.
And that's one reason some people like Advantage is because they want the dental, they want the vision, they want the drug, all to be in one plan altogether.
Right, yeah.
And so some people prefer that, and so they go that route. Others like to know that their major medical and everything else is taken care of. They'll maybe either pay out of pocket for vision and dental, or they'll get a separate policy.
Right. Quite often those don't cost a lot.
Depending on what you need.
And what your
and
diagnosis
everything like that.
Be,
and so if you have to get a new pair of glasses or your eyes checked on a very regular basis, it might be beneficial to find a good insurance plan. But typically those standalone plans aren't very expensive, even
just for basic,
even at that point. Just to have your routine checks
proactive
and things can be
kind of things.
Yeah, it can be fairly inexpensive.
Yeah. So the Medicare A and B, you do pay a little something. I always thought it's taken care of, but you do pay something.
Correct, that is correct. So Part A, if you've worked 40 quarters, you've paid into Medicare for 40 quarters, then
is that like 10 years?
That's free. Yeah,
okay.
If you've worked fully for 10 years, paid into Medicare for 10 years.
And it doesn't have to be, I assume you say 40 quarters because it doesn't have to
be
straight 10 years.
It doesn't have to be straight 10 years. You know, there's a lot of situations where like somebody becomes a mother, they've worked for 4 years, they want to stay home with their family, they do that, they've paid in for 4 years, so they have 16 quarters, then they'll go back into the workforce later after their kids get a little older or something, and then they'll accrue those quarters at that point.
Okay.
So if you have the 40 quarters, Part A is free to you because you've paid in enough that they've made an agreement that you will be covered on Part A.
It's good to know.
If you've worked less than 40 quarters, it's kind of tiered down. If you've worked between 30 and 39, it's $232 a month. If you've worked less than 30, then it's actually $435 a month. And so that would be a situation where, because of how expensive it is, it might be better for you to look at an Advantage plan if you can't qualify in some other way. And so, but if you've worked 40 quarters, Part A is free, and then Part B does actually have a deductible, or I'm sorry, a premium that you have to pay each month. And this year it's $134 a month. That has changed a little bit. Over the last few years, it's stepped up a little bit. And so, but typically most people that are taking Social Security, that will just be deducted from their Social Security check. Or you can pay private. They can send you a bill and you can pay it online. You can pay it with a check, however you would like to do that. But they can set it up to where those premiums are automatically removed from your Social Security check once you start taking Social Security.
Right. And I guess through doing workshops and those types of things, sitting in the back listening to you and your dad talk, quite often Social Security you get a little raise, but then the Medicare costs kind of go up and they sort of match, and that's how it traditionally kind of works.
The last couple of times they've gone up, the healthcare premium for Part B is, miraculously matched it pretty much dollar for dollar. And so, when we're planning, we always tell people with Social Security, whatever that dollar amount you're getting in, whether it's $500, $7,000 a month, we just expect for that to be what you get every month from now until you stop getting it. And so, we don't really count on those raises. If you happen to get one, that's great. Our experience is that any raise you get usually will be taken away from on the medical side.
It's kind of a glass half empty, half full situation, because it could be, well, this went up, but I've got this to match it, so yay, or this, and it depends on, I guess, how you look at it.
Now there is a provision in government called the held harmless provision, where you will never, if the Medicare premium does rise, but your Social Security does not go up, then they won't raise your Medicare premium. Because they want to make sure that every dollar you're getting, you still get. They won't give you anything less, but once you are supposed to maybe get more for Social Security, then they would start taking that to kind of even out what you're supposed to be paying in Medicare.
Gotcha. So and that's something out of pocket.
That won't be out of pocket as much. Good. That's something we actually have seen over the last few years. The Medicare Part B premium went from $105 to $123. And then it jumped from $123 to $134. But there were 70% of the people that were taking Medicare, or that were on Medicare, were already currently taking Social Security. So because their Social Security check didn't go up, they stayed at the $105.
Okay.
And so, but now that they've gotten a couple raises over the last couple of years, they've caught up. And so this year, pretty much everybody is paying the $134 a month for Part B. And so, so
I guess maybe it's just me, and maybe there are other folks out there, but I just thought when you get Social Security and Medicare, you don't have to pay, but you do.
Yeah, you do. It's not much,
no, it's not
in terms
much.
of
Well, it depends on what your income is.
Correct. That's correct.
That's
it is relative to your means.
Right.
But typically, most people will have, at least in their Social Security, the ability to cover what their Medicare cost is.
Good.
If your Social Security check at least covers your Medicare premiums, and then that's a win.
Yes, definitely.
And everything.
And unfortunately, we have some folks in our society that count on that Social Security check for everything. Absolutely everything.
It's I believe it was the recent statistics said that there's at least in the state of Kentucky that 60% of people that are retired, their only means of income is actually their Social Security check, and so that's why it's important to plan.
It is.
Why it's important
so
to know.
Yes.
And everything, and so
watch these shows. Come to the Right Legacy Group's workshops that they do often. Also called Focus on Finance at the library.
We value education. We love to make sure people understand what they're walking through and everything.
And it can work if people are proactive and listen to the professionals and sit down and don't wait till you're in that situation to try and dig yourself out.
It always helps to be proactive and ask questions and try to fight for yourself.
Yes.
Hey, how can I make this better, and what do I need to do to improve what's going on?
It's a complicated system.
Yeah,
it really is. But thankfully there are professionals like you and your dad, Steve Wright, in place, and other professionals in the area to help with that. I can't believe it, but we are out of time.
Oh, wow. Okay.
I know. That is crazy because this is such good information.
Sure, sure.
I am going to share with the folks that you all have a workshop coming up.
Yes, yeah,
no
and we'll talk more about the open enrollment period.
Yes.
Yeah, there's no charge. Yeah, I just do want to mention real quickly that the actual open enrollment is only to change your Advantage plan or your Part D drug plan.
Okay.
They give you an ability to do that every single year, and that's what this open enrollment period is for.
Right.
And so if you're wanting to explore those or make those changes, if your prescription needs have changed, that's what the open enrollment period is for.
Is that when folks can change? Let's say I've got Medicare C. Can I change my mind and say this isn't what I wanted? Can I go to? Is that a time to go to
yes,
A and B?
This is the time that you would switch off of Medicare Advantage to traditional, or if you want to go from traditional to the Advantage plan, you can do that now. And then changing your drug plan, you can do that every year in this open enrollment
So there's some
period.
wobble. You don't get in there and, oh no, this isn't what I wanted or what I thought, and I'm stuck forever.
Correct.
Okay.
Yeah.
So that's kind of what that open enrollment is
about.
Yeah,
they want to give people some flexibility as to when they can change their Advantage plans, their drug plans, that kind of stuff, change course, and so.
Okay, okay, so there are options. It's not that scary then. Okay, great.
Absolutely.
Well, Austin, thank you so much for your time.
Well, thank you for having me.
Appreciate that, and folks need to check out these workshops, whether it's with the Right Legacy Group or someone else. Go online, be proactive, and get some information and education. I'm Melanie Parker. Thank you for your time, and I'll see you next time.
I consider it an honor to be able to work with my father. It's always a unique experience, not only having been raised by him, but now working alongside of him. I get to see how consistent he is. You know, the principles that he raised me with, I get to see him work out every day and live out in the way that he works with clients, as well as the way that he leads the business.
3 decades ago, I went on my own, hung my own shingle. When you do that, you're taking a lot of risk. That's what entrepreneurs do. But I came to a point in life that I got tired of trying to live by other people's rules. There's a higher standard of the rules that I want to live by and raise my family by.
I saw the way that he was able to just build relationships with those that he was working with. You could just tell that what he was doing made a difference. And that's something that I wanted to be a part of.
The word legacy is a word that's been around a long time. Legato, I think, is where it actually, the root of the word there. The Bible says that a wise man leaves a legacy, an inheritance to his children's children. So in our planning, we are trying to make sure that people are not only living and taking care of their needs of their family today, but are creating a long-lasting effect so their children and their grandchildren can have a better life and a better future. The Right Legacy Group is a combination of advisors that can provide individualized, tailored plans to families. Teenagers, the millennials, the Gen Xers, Gen Yers, and the seniors that we love so much.
A legacy is how you're remembered. A legacy is who people see you are and what your values are. It's not just monetary, it's about who you are and what defines you.